Welcome to Adapting Class. This is the Pediatric Health Assessment. I have 12 questions for you. These questions are really hard, but they focus on those vulnerable patients. If you know this, you're good with the Pediatric Health Assessment. So let's get to it. First question, same strategy, same way of answering questions from the back. Which gross motor skills? You know, when I put gross there, that's what I want you to pay attention to. The next you expect. What should I expect? A 3-year-old is in the ped clinic for examination. We're looking for gross motor skills. The next you expect. What do you think? It's a 3-year-old. 3-year-old is the end of toddlership, right? In the beginning of what? They're going to become a preschooler, right? So end of toddlership and beginning of preschooler. The way I remember them, if you're 3, you got to ride tricycle, right? You're not ready for a just 2-legged bicycle. Basically, you got to do tricycle. You need one more support from it. So this one I expected. And then they can jump off the bottom of the steps. This is something you just have to know. They can do that. And they can stand on one foot for a few seconds, but they're not strong yet. That's why they do what? They have a tricycle on. So they can stand on one foot for a few seconds. And then what do? They can skip and hop on one foot, but they cannot jump a rope. This requires some fine tuning and some strength to jump on rope and then jump both into the sky and land and then jump again. They are not ready to do that. They're going to fall. So what the next you expect is 1, 2, 3, 4, but not 5. They are not ready. It's when they get to the 4 years later, they will start doing that. For a 3-year-old, this is what they can do. These are landmark features you should know. Now, the next one is a 2-year-old. No, it's question 2. A 4-year-old is having problems sleeping. This happens all the time, this age group. You know, 4-year-old, they're between 3 to 6. So this is the preschooler, basically. And they are the magical thinkers, okay? Magical thinkers. Which of the following teaching is appropriate? They are afraid of going to bed. The major problem with this age group is what? Nightmares. They have nightmares, so that's why you should help them deal with that. At least they have to sleep for 12 hours, and this will help with their sleeping. You should keep a constant bedtime routine so that they can go to sleep at the same time. You should avoid them watching TV before they go to bed, you know, or computer or anything. Avoid media use before bed. Ensure media content is non-violent so that they don't, dream about it and they have nightmare. Reassure client if frightening about night terrors. Yeah, you got to tell them nobody's coming to take you away. So these are the strategy you can use to help them sleep because of nightmares they have, but you have a consistent strategy to get them to sleep. Okay, straightforward questions, but a little bit of content you have to know. So that's what I'm giving you. Which of the following activities is activities buzzword? The next should include to prevent what? Regression. Why? A nurse is caring for a 4-year-old. So a 4-year-old is admitted to the hospital. Like I said, this is the preschooler, right? In the hospital. What can they do? You know that this 3-year-old, what kind of play? Associate play. That's what they like very much. And you want to help improve their fine motor skills and then improve their language. So whatever activity you're going to give it to them is improving fine motor skills, language, and take into consideration the associate play they do. When you put puzzle together, yeah, that's fine motor skills. So this is good. And you can do it associately without nobody is a leader of it. You can color crayons is good. Fine motor skills. You can hold that crayon. And then musical toys that can make noise. That they loved it. And playing with puppets because of their magical thinking is good. Pulling a wheel, there's no need. This is for gross motor, not fine motor. You put in a wheel, they don't need to be pushing things on the ground. This is a toddler lifestyle, so you should not include that. So the one you should include 1, 2, 3, and 4 are your right answers. When they ask you these questions, think about what they can do, what kind of play system they are in, and then you can figure it out. So number 4, the same thing, right? Which of the following is concerning? A 4-year-old boy, parents are concerned about their child. When they tell you what is concerning, don't answer the question. Think about it. Put the kid in a certain age group, right? He's a preschooler. What do you expect in these people? They're still learning their fine motor skills. So if my kids spend a lot of time trying to button a shirt, that's classic, normal. The child does not stop talking about puppet. They think animals is alive. It's imaginary thinking, right? The copycat, dress up like his father. Classic, preschooler. Temper tantrum, no way. My child will throw a temper tantrum with every task. No, this is a toddler, so it's still in the toddler stage. You should go, these temper tantrums should start going away when they get to the preschool age. So based on Erickson behavior, this kid is still not developing well. So we got to worry about it. Why are you having temper tantrum for everything as a preschooler? Is not acceptable. Number 5, what do we have? 5-year-old wake up frequently with nightmare. Remember, 5-year-old. It's a preschooler, I told you, and they have nightmare. He does not want to sleep alone. Which of the following teaching is appropriate? So what would you do? Now, we already talked about it, but it's the same question. I frame it differently for the concept to be ingrained in your head. Like they have nightmare problems. So have a sleeping cycle that is consistent, avoid certain things. Ensure TV time before bed. No, you watch TV, you see some animals and other things, you will have nightmare and you won't be able to sleep. Increase physical activity before bed. No, you get tired when you do that. You can't sleep. Serve the baby large carbohydrate meal. No, you cannot do that. Not a baby, but not serve the child large carbohydrate meal. You know, large carbohydrate meal can affect your sleep. Even adults, you don't do that. A consistent schedule is the best way to ensure so that the kid does not wake up and be frightening. Okay, so that's number 4. Number 6. A nurse is caring for a 2-year-old, right? Put him in his right place. He's the toddler. Which of the following activities the nurse should include in the plan of care? 2-year-old, you know what they do, toddlers, right? You know them. You want to improve them so that they can start thinking, they can do things with the gross motor and be able to use it perfectly. Looking at books, they love it. Playing with blocks, they play with it. They toss ball. They do push, you know, for gross motor strength. But building models is too advanced for the kid. It's too advanced. That requires a lot of thinking, cognitive thinking. A 2-year-old building a model where it may be genius, Einstein kind of kid. But looking at the books is easy for them so that they can improve their reading, playing with blocks. That will help with their gross model and tossing the ball. The same thing. There's no fine motor development there. Basically, gross motor development. Playing with push and pull toys, not toys that make music, but they push them away. That's what they like. They don't build models. So which one should be included? 1 to 4. And this is also content I just want to provide. Most of this is content. Which of the following is concerning? That means this age group is not getting it. And this is reviewing nutritional practice of a mother of a 2-year-old child. 2-year-old is a toddler. What is mother doing that is bad? That is what the question is. Sometimes when you write this question with a bunch of words, rewrite it. Nutritional practice of a mother of a 2-year-old. What I'm trying to ask you, what is this mother doing for this 2-year-old that you should worry about? There's content you have to know. I serve the child 8 to 10 ounces of juice a day. It's too much. Okay, too much. This is the recommended 4 to 6 ounces of juice, because to avoid too much sugar. So if you don't know, this is a serve, 4 to 6 ounces of juice. 8 ounces is like 1 cup. It's too much. So, but I know some people drink more than that. The recommended is 4 to 6 ounces. My child prefer finger food. Yeah, this age group, they like something to pick on it to improve their fine motor skills as they progressing from the gross to this thing. So this is good. Okay, this is wrong. I serve the child not popcorn and raw carrots. What is the major risk for these people? Aspiration, not popcorn. They put things in their mouth easily. So they have aspirate, they can aspirate. So not popcorn, you don't give them things that will make them aspirate. So this one is concerning, but this is good. This is concerning. So I guess I'll put concerning this way and this one not concerning. I will make sure food is cut in the small bite. That's good because of this, so that they don't aspirate. So this is not concerning. I ensure serving is 1 tablespoon for each food item. This one is just a content. In this age group or any other age group, we usually give them what? 1 tablespoon per age group. What does that mean? If you're 1-year-old, you get 1 tablespoon. If you're 2-year-old, 2 tablespoons. If you're 3-year-old, they get 3 tablespoons of each food item. If you're 4-year-old, you get 4 tablespoons of each item. Each 2-year-old, you shouldn't be getting 3. So this is also concern. I serve the child 2 cups of whole milk. Do you see anything wrong with it? When you, at the age of 2, you should not be drinking whole milk anymore. We don't want you to get too much cholesterol. So you go to low fat and then after milk, this thing, basically concentration, not the full one. So they should not be getting whole milk anymore, and low fat and and silk milk, those kind of things we give them. So this one, you serving the whole milk is too much. So concerning giving 8 to 10 ounces, we need to give 4 to 6 of juice. Giving not popcorn and raw carrot, which is bad for choking. Serving 3 teaspoons for a 3-year-old. Tablespoon, you should give 2 tablespoons, and serving 2 to 3 cups, which is normal, but not a whole milk. It's a half a milk or low fat diet. Low fat milk for the kids. Okay. Number 8, this is the same thing concept. And then she's teaching the mother of a 2-year-old about injury prevention. Which of the following statements need further teaching? So they did something wrong. Further teaching. 2-year-old toddler. I keep toy with small part out of reach to prevent aspiration, like I said. I serve my child grapes with each meal. If you're doing 1, you shouldn't be doing 2. Test-taking strategy. Grapes are small. You can put it in his mouth and it will choke. So further teaching. I teach my child about stranger safety. Yeah, so that they know what a stranger is, who to talk to, and when they shouldn't be afraid, but you know, if they're telling them something is bad, they should watch out. I check the smoke detector battery regularly so that it's working, functioning. When you need it and there's fire, it can work. I turn the pot under towards, look at what I said, towards the front of the stove. If this is the stove and this is the pot, you turn this is the back, okay, and this is the front. So you standing here and you put a handle in front of you. No, the kid will come and grab this, and whatever is inside will pour on his face. You want to put a handle towards the stove, not in front of the stove. So this is need further teaching. My child goes to the pool with the other child. No, he has to be supervised by you. The other child has no time to supervise. He to be swimming. So yeah, it's a problem. These are all concepts I want you to pay attention to. Pediatric, you don't know what they will bring, but there's safety issue, eating habit, and those things. The board like it very much. Number 9. Same thing, strategy, information. Which of the following the next should include in the teaching? What? And then providing teaching to a new graduate about developmental milestone in what? This is an infant, right? 2 days and 1 year old. 2 days to 1 year. What? Posterior fontanelle. You have to know these two. Don't forget them. Posterior fontanelle are the one that closes early. It closes by what? 2 to 3 months. The anterior one lasts longer, 12 to 18 months. So this should not be included. This one is 2 to 2 months. Anterior fontanelle, 12 to 18 months. Don't forget that. Infant loses 5 to 10 pounds the first week, and the second week, they will gain all of them back. So this should be included. Weight gain is that 5 to 7 ounces per week for the first 6 months. So you can calculate. You can, if you know these numbers, you can calculate. If I tell you a kid weight now and is 6 weeks or 8 weeks, you should be able to calculate because they gain 5 to 7 ounces per week. So this is right. Birth weight should double by 6 months, yes. And then it should triple by 1 year. Double 4 to 6 months, triple 1 year. So if your weight is what, 7 ounces by 6 to what did they go? 6 to 4 to 6 months, you should have it double than what it needed to, and then it should triple depending on what they are waiting. Okay. Number 10. And this is providing teaching to a new graduate about age-appropriate toys for the infant. 2 days, 1 year old, that's infant. Which of the following the next should include in the teaching? I told you these are gross motor and other things they want improved. They're not that strong. They don't have thinking ability. So yeah, play, patty cake, excellent. Rattles is perfect. Mobile toy, yeah, they can look at it left and right. And nesting toys is good. Okay, they're not ready to play with the block yet. They're not ready at all. They don't care about it. They want something they can concentrate on and move back and forth. So these are all nice for an infant, not playing with the block. So that one is off. These playing with the block, usually toddlers, as they improve their gross motor function. These guys are solitary, so solitary play. So these are all nice for them. And then number 11, select or apply. And next is assessing a 6-week-old infant. Which of the following the next should expect? It's 6 weeks, so a month and 2 days, 2 weeks. I told you posterior fontanelle closes what? 2 to 3 months. It's not 2 to 3 months here. So I should not expect this. Strong palmar grabs reflex. Yes, this is very strong. And it should start fading very soon by the time they get to the 2 months. So this is okay. Their head lag is perfect. That's how they lead. They cannot lift their head off the mattress until they are like 2 months and above. And of course, pencil grab, the crude one is 8 months. Okay. No, 9 months. That's when they start to develop it. 9 months. And then the fine one is 10 to 12 months. So this is 9 months. So this is not expected. This is not expected. The only thing that is expected is 2 and 3. And the last one. Last one is the same thing. Select or apply. And this is providing safety teaching to a mother of a 6-month-old. So all these things, you should stop the video, answer it, and see what I would say. That's the best way to. Which of the following the next should include? Select or apply. Safety issue. Okay, 6 months old. It's an infant. No pillow in the crib. Yes, we don't want the kid to suffocate. Place infant on the back. Yes. Sudden infant syndrome. This will prevent SIDS. Soft crib mattress. This is a trap. Okay, you think it's soft, gentle is good for you. No. Soft, they can suffocate. You want a hard mattress. And it should fit in the crib tightly so that there's no space. If this is the crib, the mattress should be like tight. There's no space. Otherwise, if you have something like that, what happened? There's space here, the kid roll and go here. We have a problem. So keep the crib slit 12 centimeters. This is too long. You need 6, half of it, so that they cannot go through and fall off. Hang crib mobiles for entertainment. This is also a trap. By 4 to 5 months, they don't need these mobiles anymore because they can grab on it and they can put it in their mouth. Therefore, this is not good. So which of the following the next should include? No pillows. Place infant in the back. 3, 4, and 5 are all wrong. This is the end of it. That should give you enough arsenals for your exams, a bunch of pediatric. We've done 5 series. Take care of yourself and keep charging as always. Bye-bye.